Thousands of years ago, human ancestors survived harsh wilderness with remarkably clean teeth, despite having no toothbrushes or dental clinics. Daily. Archaeological excavations across European cave sites reveal fossil skulls with straight, intact teeth showing virtually no signs of decay. Daily. Modern humans suffer rampant tooth cavities and gum diseases, while ancient hunter-gatherers had cavity rates of less than 2%. Daily. Without fluoride paste or synthetic mouthwash, primitive humans maintained robust oral health throughout 40 grueling years of life. Daily. Ancient skulls dating back 30,000 years present wide dental arches with perfect spacing for full sets of wisdom teeth. Daily. Today, crowded teeth and impactions are commonplace, yet prehistoric fossil records rarely demonstrate any crooked tooth patterns. Daily. Paleoanthropologists studying Neanderthal jaws were stunned to find minimal plaque buildup and strong jawbone density throughout. Daily. How could early humans maintain pristine teeth in wild terrain where dental infection could quickly trigger lethal blood poisoning? This was part of ordinary survival. A single untreated dental abscess in the Ice Age could lead to fatal septicemia, making oral protection vital for clan survival. Daily. Natural selection ruthlessly eliminated any bloodlines that could not withstand severe oral bacterial onslaughts in the wild. Daily. Every meal was a physical struggle against fibrous roots, tough wild game sinew, and abrasive unrefined wild vegetation. The practice required patience, not machinery. The secret to their cavity-free mouths lay hidden inside daily survival habits, unrefined diets, and ancient instinctual hygiene. Daily. Microscopic examination of fossilized dental plaque has unlocked a forgotten microbial universe preserved for millennia. For them, hygiene began with daily movement. Calcified calculus acts like a time capsule, capturing dietary fragments, medicinal plant pollen, and beneficial bacteria. This quiet routine protected the whole clan. These microscopic archives prove that ancient hunter-gatherers actively cleaned and maintained their teeth daily. This was part of ordinary survival. Daily. They did not simply rely on luck, but utilized specialized natural tools, mineral abrasives, and antibacterial plant extracts. It happened through repeated daily habits. Understanding their prehistoric oral ecosystem challenges modern assumptions about toothpaste and commercial dental products. Daily. Let us explore how our ancestors mastered natural oral hygiene and kept tooth-destroying bacteria completely at bay. The practice required patience, not machinery. The primary defense mechanism against tooth decay was the coarse, unrefined diet consumed by ancient foraging bands. Evidence survives in teeth, tools, and ancient soil. Hunter-gatherers consumed fibrous tubers, raw nuts, gritty wild berries, and tough dried meats requiring immense chewing force. Daily. This constant heavy mastication generated intense friction across tooth surfaces, physically scraping away soft sticky plaque. Daily. This was part of ordinary survival. Unlike soft modern processed foods, ancient meals acted like coarse natural scouring pads during every chewing cycle. This was part of ordinary survival. Microscopic grit and stone dust from grinding tools naturally blended into food, lightly polishing enamel surfaces clean. It happened through repeated daily habits. Vigorous chewing stimulated salivary glands to produce up to twice the volume of saliva seen in modern humans today. No formal clinic was needed for this routine. Saliva served as a potent chemical shield, rich in bicarbonate ions that neutralized dangerous bacterial acids instantly. The practice required patience, not machinery. Enzymes like lysozyme and lactoferrin in saliva actively broke down bacterial cell walls before biofilm could solidify. Daily. Crucially, the prehistoric menu was completely devoid of refined sucrose and processed soft carbohydrates. For them, hygiene began with daily movement. Without simple sugars, the notorious cavity-causing bacterium Streptococcus mutans could not thrive or produce acid. This quiet routine protected the whole clan. Wild fruits contained bitter polyphenol and astringent tannins that actively suppressed microbial attachment to enamel. This was part of ordinary survival. High dietary intake of vitamins A, D, and K2 from organ meats and wild game ensured dense, highly mineralized tooth enamel. It happened through repeated daily habits. Massive jaw muscles developed from childhood, expanding the dental arch and preventing crowded or misaligned teeth. No formal clinic was needed for this routine. Properly aligned teeth eliminated tight crowded crevices where modern food debris typically rots and breeds infection. The practice required patience, not machinery. Natural teeth were gradually smoothed away deep occlusal fissures, eliminating pits where cavities normally start. Evidence survives in teeth, tools, and ancient soil. This mechanical flattening created self-cleaning biting surfaces that food could not easily stick to or ferment upon. For them, hygiene began with daily movement. Their diet did not just nourish the body, it functioned as an automated cleaning protocol during every waking meal. This quiet routine protected the whole clan. Yet when diet alone was insufficient, early humans turned to deliberately crafted mechanical hygiene instruments. This was part of ordinary survival. Daily. The oldest direct evidence of intentional human dental care dates back over 1.8 million years to Homo habilis fossils. It happened through repeated daily habits. Fossilized teeth from Dmanisi, Georgia reveal distinct microscopic cylindrical grooves etched between molar roots. No formal clinic was needed for this routine. These interproximal grooves were produced by repetitive, habitual insertion of rigid bone, wood, or quill toothpicks. The practice required patience, not machinery. Neanderthals at El Sidrón cave in Spain regularly used polished wooden slivers to alleviate painful gum irritation. Evidence survives in teeth, tools, and ancient soil. Hunters carefully selected flexible twigs from specific tree species known for aromatic oils and antibacterial sap. For them, hygiene began with daily movement. By chewing the tip of a fresh fibrous twig, they created a soft bristled brush known as a prehistoric chew stick. This quiet routine protected the whole clan. These chew sticks rubbed across enamel surfaces to scrub away food particles and massage delicate gum tissues. This was part of ordinary survival. Daily. Plants like willow contained salicin, a natural pain reliever that reduced gum inflammation and tooth sensitivity. It happened through repeated daily habits. Birch and pine twigs provided natural xylitol and antimicrobial terpenes that inhibited bacterial plaque formation. No formal clinic was needed for this routine. Archaeologists also discovered fine microscopic striations indicating the regular use of primitive dental floss. The practice required patience, not machinery. Early humans threaded thin animal sinews, tough horsehair, and shredded plant fibers tightly between their teeth. Evidence survives in teeth, tools, and ancient soil. This primitive flossing dislodged rotting meat fibers before anaerobic bacteria could trigger destructive gum pockets. For them, hygiene began with daily movement. In a 14,000-year-old skeleton from Villabruna, Italy, scientists discovered the world's oldest dental filling. This quiet routine protected the whole clan. An infected molar had been carefully excavated with tiny microlith flint points to scrape away decayed blackened tissue. This was part of ordinary survival. The excavated cavity was then sealed with natural beeswax and bitumen to block air and prevent reinfection. It happened through repeated daily habits. Bitumen and resin acted as natural antiseptic sealing agents, protecting delicate nerve endings from cold liquids. No formal clinic was needed for this routine. These remarkable artifacts demonstrate sophisticated surgical precision and practical knowledge of oral anatomy. The practice required patience, not machinery. Beyond mechanical tools, our ancestors exploited an extensive botanical pharmacy to sanitize the oral microbiome. Evidence survives in teeth, tools, and ancient soil. Prehistoric foragers were master ethnobotanists who recognized the healing and antibacterial properties of wild flora. For them, hygiene began with daily movement. Tree resins, particularly from pine, mastic, and frankincense, were chewed routinely as natural antiseptic chewing gums. This quiet routine protected the whole clan. Chewing natural tree pitch released potent terpenes and phenolic compounds that annihilated oral pathogens on contact. This was part of ordinary survival. Archaeologists in Sweden recovered ancient pitch lumps showing clear human tooth impressions dating back 10,000 years. It happened through repeated daily habits. DNA analysis of this chewed pitch revealed traces of ancient medicinal herbs alongside oral bacteria and viral fragments. No formal clinic was needed for this routine. Herbs like wild sage, mint, thyme, and yarrow were packed around sore gums to reduce swelling and eliminate foul breath. The practice required patience, not machinery. These plants contained powerful essential oils like thymol and eugenol, which modern dentistry still uses as antiseptics. Daily. 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 Wood ash from campfires was occasionally applied with wet fingertips as an alkaline abrasive powder to polish teeth. For them, hygiene began with daily movement. Fine charcoal particles absorbed foul odors and toxins while mildly abrading persistent stains without gouging enamel. This quiet routine protected the whole clan. Mineral clays containing calcium, magnesium, and silica were swished with water to remineralize microscopic enamel pores. This was part of ordinary survival. The ancient oral microbiome was vastly more diverse and ecologically balanced than that of modern industrialized populations. It happened through repeated daily habits. Beneficial commensal bacteria occupied every ecological niche on the tooth, preventing harmful pathogens from taking hold. No formal clinic was needed for this routine. Species of actinobacteria and non-pathogenic streptococci maintained a neutral pH, neutralizing temporary acid spikes. The practice required patience, not machinery. Calcified calculus formed naturally, creating a hard mineral barrier that sometimes physically insulated roots from decay. Daily. 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 Although heavy calculus could inflame gums, it frequently preserved the underlying enamel in pristine, unrotted condition. For them, hygiene began with daily movement. Dietary diversity ensured that no single bacterial strain dominated or turned destructive against host gum tissues. This quiet routine protected the whole clan. This dynamic botanical defense created a resilient oral ecosystem capable of surviving decades without modern intervention. This was part of ordinary survival. However, ancient oral life was not without catastrophic risks, extreme physical pain, and severe mechanical attrition. It happened through repeated daily habits. While cavities were remarkably rare, extreme tooth were presented a severe and debilitating hazard for older hunters. No formal clinic was needed for this routine. Decades of grinding coarse grit and chewing animal hides wore crowns down to the gum line, exposing sensitive pulp chambers. The practice required patience, not machinery. When the pulp canal opened, bacteria invaded the root tip, creating massive bone-eroding periapical abscesses in the jaw. Daily. 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 These agonizing infections eroded cortical bone and frequently forced clan healers to attempt crude tooth extractions. For them, hygiene began with daily movement. Tooth loss in old age severely limited nutritional intake, requiring clan members to pre-chew food for elderly relatives. This quiet routine protected the whole clan. The true disaster for human oral health began 10,000 years ago with the birth of the agricultural revolution. This was part of ordinary survival. Farming societies shifted from diverse wild meats and fibrous roots to soft, carbohydrate-heavy cereal grains like wheat. It happened through repeated daily habits. Sticky cooked porridge and bread clung to tooth fissures, providing endless fuel for acid-producing bacterial colonies. No formal clinic was needed for this routine. Archaeological records show an explosive spike in cavities, rising from 2% in foragers to over 40% in farmers. Daily. 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 Soft agricultural diets drastically reduced chewing demand, leading to smaller, underdeveloped jawbones across generations. Daily. 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 Narrow jaws caused wisdom teeth impaction, crowded dentition, and crooked bites that modern humans still struggle with. For them, hygiene began with daily movement. The industrial introduction of refined sugar in the 17th century dealt the final devastating blow to human oral health. Daily. This was part of ordinary survival. Modern humanity now battles permanent biofilm dysbiosis, relying entirely on synthetic pastes, brushes, and dentists. This was part of ordinary survival. Yet ancient hunter-gatherers proved that optimal oral health begins with what we chew, not merely what we brush with. It happened through repeated daily habits. Eating tough fibrous foods, eliminating refined sugars, and stimulating saliva remain the most powerful oral defenses. No formal clinic was needed for this routine. Our prehistoric ancestors bequeathed a profound evolutionary blueprint for maintaining strong, resilient, cavity-free teeth. Daily. 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 How would your dental routine change if you had to rely solely on the tools and botanicals of our Paleolithic ancestors? Daily. 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 Share your thoughts in the comments below, subscribe for more prehistoric mysteries, and explore our full ancient survival series. Daily. Daily. Daily.